Good morning, everyone. My name is Ronalyn Faren, and I will be sharing and discussing to you about this iTunes application regarding the most commonly used drip in the ICU. ICU drips are an illustrated and concise analysis overview of the common drips used in the critical care setting. This application was last updated on August 13, 2011. It has a one-time fee of $1.99. The purpose of this presentation is to share and inform other healthcare providers about the most commonly used drips in the ICU settings. Used it as an educational reference and how nurses benefit from this application. However, nurses should always exercise clinical judgment, sense, and apply critical thinking in order to provide safe and good quality care. Utility of application. The use of this application play as a quick guide to all commonly used drips and infusions used in the ICU. There are so many drips medication that nurses are not very familiar with. Therefore, it is very important to have something handy in times of emergency situation. It will save the nurse the time to search for medication. But it is always a safe practice to have somebody check your drip medication before starting it to make sure it is the right medication, right dose, and most of all, giving it to the right patient. Commonly used infusions. There are many IV drips medication used in the ICU. It could be weight-based or non-weight based. Dosage will include mics per kilogram per minute, milligram per kilogram per minute, mics per kilogram per hour, units per kilogram per hour, milligram per hour, mics per minute, milligram per minute, mics per hour, units per minute, and units per hour. To categorize them, we have drugs or drips for antiarrhythmic like amiodarone, cardizem, isoprel, lidocaine and procainamide. Antihypertensive like labetalol, cardine, tridol, nipride and ismolol. Antihypotensive for shock, or sometimes we call it vasopressors like dopamine, dobutamine, epinephrine, phenylephrine, and vasopressin. Anticoagulants include abscesimab, argatroban, Angiomax, integralin, and heparin. Neuromuscular blocker or paralytics like Nimbix, Pavilon, Norcuron, and Zimiron. Anticonvulsants like pentobarbital. Sedations like Versed, Diprivan, and Presidex. Opioids like fentanyl and morphine. Altiplase for clotbuster. Regular insulin for antihyperglycemic, furosemide for diuretics, and protonics and octreotide for active GI bleed. Usability of application. This application contains more than 35 drips medication. Very simple and easy to use and navigate. Medications are listed in alphabetical order, concise, and has important information in regards with each drip medication. New ICU nurse will become more familiar and comfortable with ICU drugs, and this application is compatible with iPhone, iPad, and iPod. Legal and ethical. There is no legal and ethical issues in pertains to this application. However, jailbreaking is one of the most controversy that Apple faces in regards to iPhones. Jailbreaking is the same as hacking. Users has the ability to connect and download any application for free, which Apple think that it should be illegal, but there is no way to stop users to do jailbreaking on their iPhones. Overall analysis. Having this application available on any Apple device like iPhone, iPad, and iPod are very useful and helpful in the nurse's side, especially in the ICU settings. This could serve as an educational quick reference in times of emergency. This application costs the consumer a one-time fee of $1.99. Easy to manage, accessible for personal use, has great benefit to all consumers because technology used in these applications and handheld devices are remarkable. At the end, I really recommend this application because it is easy to use, self-explanatory, contents is simple, could use for educational purposes, and handy anytime. Conclusions. Overall, having this application help critical care nurse familiarize themselves in regards to commonly used drips in critical care setting. Drips is what make ICU an ICU, wherein nurses have to take care of critically ill patient, work with multiple doctors and co-nurses. The challenge and the application of critical thinking makes the nurses feel the ICU environment. It saves time, and at the end, nurses able to provide safe, quality care in a timely manner. And that concludes my presentation. Thank you.